Mondays to Fridays for our morning raw or midnight raw from 12 a.m. US time, 4 a.m. Ghana time, 5 a.m. UK time, 6 a.m. Europe time, 7 a.m. Lebanon time, and 1 p.m. Japan time to pray. We also meet Mondays, Thursdays, and Fridays for our Zion as well as time with the word of God, respectively. And the times are 12 p.m. US time, 4 p.m. Ghana time, 5 p.m. UK time, 6 p.m. Europe time, 7 p.m. Lebanon time, and 1 a.m. Japan time. So if you have time, pass by and let us worship God. Today, we have a very special person in our midst, and she is going to be discussing the topic hypertension and diabetes. Of late, we hear this, almost everywhere we go. These, diseases or ailments have come to stay with some of us, and we want to find out how we can deal with these diseases. She's no other person than Dr. Abena Yeboah. She is a senior staff at the Pentecost Hospital located in Medina, Accra, Ghana. She said you should put all your questions and concerns together, and when it gets to the question and answer section, you bring them on board, and she will do all that she can with the help of God to make sure, she tackles whatever you have for her. Dr. Yeboah.
Hello.
You are looking gorgeous out there.
Thank you. Thank you.
How are you?
I'm good. Yourself?
I'm doing very well by the grace of God. I want to say a very big thank you. The prompt response that you gave me when I asked if you could do something with us. You're like, oh, Lena, why not? Definitely. So long as it is for the children of God, I am ever ready to do that. So we are here today. Hello, little one out there. Yeah. So, hello. Yes. So our audience are here with us. They can't wait to hear from you. Let's roll. Hypertension and diabetes.
Okay. Hello, everyone.
Big issues.
And diabetes. Hello to everyone. My name is Dr. Abena Yeboah, and I'm a senior medical officer working with Pentecost Hospital at Medina Estate. So I feel so blessed to be called upon today to share with you this topic because it's a common one that we find within ourselves. Before I start, I would like to share one scripture before I begin with everything. So I'll take my reading from 3 John 1-2. So it says, "Dear friend, I pray that you may enjoy good health and that all may go with you, even as your soul is getting along well." Amen. Amen. That's from 3 John chapter 1, verse 2. So why the topic hypertension and diabetes, if someone may ask? I found this very important for us to discuss because these are one of the most commonest conditions that we find worldwide. And also in Africa, there are a whole lot of myths surrounding diabetes and then hypertension. So most of the time, people are saying that when you take the medications, this and that and that and that, in Ghana, you give them medications and they are not actually compliant because of one or two things that they've heard outside the hospital. So I thought it wise to touch on this topic and also debunk all the myths surrounding it.
Right.
So diabetes and hypertension, I would like to start with the definition and then go ahead with the symptoms and all that. Diabetes and hypertension usually occur together. And so we, the health workers, call it comorbidities. So when we say comorbidities, it means two conditions that exist together and can also cause harm to the human body. So when we talk about diabetes and hypertension, they increase a person's risk of cardiovascular diseases or heart diseases. That is why we always want to educate people about it. So according to WHO, there was a study done which made an estimation of about 1.13 billion people living with hypertension. And it's also a commonest cause of premature death worldwide. So I'll start with the basics. Hypertension. When we say hypertension, what does hypertension mean? So hypertension simply means that it's a force that is exerted by circulating blood against the blood vessels. So it is a force that is caused by the circulating blood against the vessels or the arteries. And blood pressure can be recorded in two values. So whenever you take the SFIC, the layman will call it the BP apparatus. When you take the BP apparatus and then you check your BP, you are going to see two values. There's an upper value and then there's a lower value. So the upper value is termed as systolic blood pressure. Systolic blood pressure. And what does it indicate? So the systolic blood pressure, or the pressure that's the value that we see on our BP monitoring machine as the higher value, represents the pressure of the blood vessels when the heart contracts. So with the heart, it's a muscle. The heart is a muscle. It contracts and then relaxes. So it contracts and relaxes to release blood to the various parts of the body. So when you check your BP, the higher value is when the heart is contracting. That is when you have that first recording, that is the upper value. And then the lower value is called the diastolic blood pressure, which is the lower value. It is the pressure that the blood vessels exert when the heart relaxes. When the heart contracts, we have the higher value, which is the upper value, the systolic BP. And then the lower value is when the heart relaxes. Please, are we getting it right?
Yes, we are getting it very well.
Okay. So one may ask, if I check my BP, what is the normal value that I'm supposed to get? So the recording for a normal BP is 120 over 80 millimeter per mercury. So the millimeter per mercury is the unit in which BP is measured. But you are supposed to have 120 over 80. That is the normal blood pressure that everyone is supposed to have. Okay, so there are some people who check their BP and it is slightly above the 120/80 value that we are supposed to get, which is the normal value. So sometimes you could have 120, above 120 to 129, which is the higher value, and then the lower value being 80 or above to 89. That is called the pre-hypertension state. So if you check your BP and you're not getting the normal value, which is 120/80, you're getting above that to, let me say, 129 to 89 over 89, that means you are in the pre-hypertension state. Okay. So when do we say somebody has hypertension? When you check your BP and you have a recording of 140 over 90, 140 over 90, then we say you are hypertensive. We call it borderline BP, which means that you are now manifesting hypertension. So whenever you check your BP, you have 140/90, you are diagnosed with hypertension. Do we get it?
Yes.
Okay. There are some few cases where somebody gets hypertension and it becomes an emergency state or an urgent thing for us to work on just right away. So when you check your BP and you have the systolic being 180 or more, and then you have the diastolic of 120 or more, it means you are having a hypertensive urgency or crisis. And that can actually cause a stroke, it can cause cardiovascular diseases, and we doctors have to urgently attend to such a person, or the person could die just right away. Do we get it?
Yes.
Okay. What are some of the risk factors that can put a person into hypertension? What are some of the risk factors? So a family history. Let me say myself, there's a family history of BP in my father's family and my mother's family as well. So I stand a very high risk of also getting hypertension. What do I do then? So since I know that it is in my family line, I have to make sure that I eat rightly, I exercise, and then I monitor my BPs so that I don't get into this state. So the first thing that will cause a person to be at risk is a family history of hypertension, be it your dad, your mom, your uncle, but usually it is the direct relative, like a mom or a dad, a brother, bigger brother or something.
Right.
Yes. Pregnancy-induced hypertension is a second cause or a risk factor for hypertension. So somebody will ask, why would pregnancy cause hypertension? So there are instances where somebody gets pregnant and then it causes their BP to be high. Yeah. Let me say I'm a first-time mom, or this is my first time of being pregnant. It's actually put a strain on my body, some kind of stress on my body. And then it puts me at risk of having hypertension. Some people also don't get pregnant early. Let me say by the age of 35 and you are pregnant. So your body can't really stand the stress of the baby being there and all that. And it puts you at risk of hypertension. Some also have multiple pregnancies, like triplets or twins or quadruplets. All those things can also cause you to get pregnancy-induced hypertension. Another risk factor is sedentary lifestyle. So we've realized that nowadays, most of us just drive in air-conditioned cars, and then we get to our workplaces, we just sit in air-conditioned room, sit down for a very long time, work and come home. When you come home, you are tired, you have kids that you have to take care of, dinner and everything. You don't even exercise. So this kind of lifestyle, sedentary lifestyle, so you are not using a lot of energy, you are just eating breakfast, lunch, supper without utilizing that energy. So it tends to put you at risk of hypertension. Please, do you understand?
Yes.
Okay. And lack of exercise, I think it will go with the sedentary lifestyle. Also, excessive consumption of salt. Some people like salt a lot, so you give them food and they still have to add some amount of salt before they can actually taste the food well.
The French fries and all that.
Yes, exactly. KFC and what else. Some people, they can even be given fufu and rice soup, and then they will say, I'm not really tasting salt, so let me add some amount of salt. You know, you have to quit that kind of lifestyle. So even if you know that you have a family history of hypertension, you shouldn't be doing that at all. Okay. So excessive amounts of salt in our diets can also put you at risk of hypertension. Smoking or alcohol use. So people who tend to smoke or take in a lot of alcohol also destroy their blood vessels. You know, the blood vessels contain the circulating blood, taking it from your heart to the other parts of your body. If you keep on smoking and taking in alcohol, it damages the vessels. And in that way, they can't function as they should. So in the end, you are going to be at a risk of hypertension. Also, high cholesterol levels in the blood. Those who like, how do you call it, the chofi, the KFCs, the burgers and all that, you tend to put a lot of saturated fats in your body. You build up a lot of saturated fats, which is unhealthy for you. You can become obese. And in that state, you are also at risk of hypertension. People with diabetes, living with diabetes, can also develop hypertension over a long time. If the sugars are not well controlled, they are also at risk of getting hypertension. And also increasing ages. So let me say in the men, about 55 years and above, they are at risk of hypertension. And also in the women from 65 years and above, they are also at risk of hypertension.
Okay, doctor, then let me put this question across quickly. Okay. So you made mention that if you are diabetic, your chances of, being...
I'll be coming to that because I'll be
then, right.
Diabetes as well. Okay. So what are some signs and symptoms that somebody may have to say that, oh, I think I'm having hypertension. What are some of the symptoms that you may have? I would say that you don't rely on the signs and the symptoms. So the reason why hypertension is called a silent killer, it is called a silent killer because it can be asymptomatic. So you may not feel any symptom at all. You won't have any headaches or blurred vision or anything at all, but you could be living with hypertension. That is why it is important for us to be monitoring our BPs and be checking our BPs. When there's a medical screening or something going on medically, take the pain to go there and get yourself screened. Check your BP. You can get an apparatus. If you have money, you can get your own apparatus and be checking your BPs to make sure that you are on track, so that you don't just, you won't just die and people will say that, oh, why are you? Like, he wasn't even sick and he just died. You see, it's very unfortunate when you hear news like that. So please, let's try and do that. But in few cases, you could have some signs and some symptoms. Some of the mild symptoms that you could have in hypertension are early morning headaches. So you wake up early morning and you have this throbbing headache, you have blurred vision, you have buzzing in your ears. So you should go to a pharmacy or a hospital or a clinic nearby and get your BP checked. It could be a sign that your BPs are high at that moment. That's why you're having all those symptoms, the early morning headaches, blurred vision, and then buzzing in your ears. In severe forms, you could have easy fatigability. So you do something and you are just tired. Maybe stuff that you used to do and you are okay. Now you just go to the kitchen, do some washing, and you are tired. Like you don't get it. You haven't really done any strenuous work, but you are just tired. And then confusion. You become confused. You go to work, you lack concentration. You can't even concentrate on what you are doing. So your BPs could be very high at that moment, causing the hypertension. And we also have, please, are you seeing my face well?
Yes.
Somebody is telling me she can't see my face.
Well, I can see you very well.
It's actually my mom. She's telling me she can't see my face. They can see me. They can see me.
Yes, I think it's okay.
Okay. So in the severe forms, you could have easy fatigability. You could have confusion. Sometimes it could come with nausea and vomiting. Okay, that is when the BP is very severe. It could have nausea and vomiting, and then muscle tremors. So you see somebody just shaking like that. So at that moment, when you check the BP, I'm sure you'll be getting 180 or 200 above over there. That is the very severe forms of hypertension. So we have to know this. If you are living with an elderly person or somebody that you think has hypertension and you see easy fatigability in the person, they walk just a few distance and they are tired. They climb the staircase small and they are tired. They are confused. You tell them something, they forget, they don't have clarity. You should get them checked. Confusion, vomiting, and then muscle tremors. Yes, those are the severe symptoms that you could have. Okay, so when somebody has hypertension, what are some of the complications that can come up if they are not well treated or if they are not diagnosed early to be treated? The first thing that they could have is a stroke. Okay. So with blood pressure or hypertension, there's pressure build up in the vessels. So when there's this pressure in the vessels, it tends to cause the vessels to become weakened. They can even burst, and then there could be bleeding in your brain. You know, the brain has vessels in it. So once there's a buildup of the BP, it can just cause the vessels to burst, and then there's bleeding in your brain. Sometimes some of the vessels are even short of blood as well. Okay, some parts of the vessels are dead because of the persistent hypertension, the buildup of the BP. There's also shortage of blood to the brain, and that is when it becomes stroke. Another complication that can come up is chest pain. We call it angina pectoris medically, but it is known as chest pain in the layman's term. There's also a potential of getting cardiac arrest or heart attack, or heart failure. So let me use this as an example. We have the balloon. You blow into a balloon, blow, 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 and then it extends. When it extends for a long time, and then you release the air out of it after some time, it becomes very flabby. Do you get it? So that is the same thing that happens with the heart. The heart is a muscle, and once there's pressure and then blood is pulling into the heart for a long time, after some time, it becomes weak, it becomes flabby, and that is when you start getting the heart failures. Okay.
All right.
Right. There could also be irregular heartbeat. We call it arrhythmias, and that one can suddenly just kill you. There's a pattern to which your heart should beat, like po, 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 like that. We have a first heart sound and a second heart sound. It gets to a time, if you're hypertensive and it's not being controlled, the BPs are not being controlled well, you could have this cardiac arrhythmias or the irregular heartbeats, which could just kill you like that, okay, if it's not identified early. And also kidney failure. We are seeing a lot of even young people going on dialysis. Why? Because some of them were diagnosed with hypertension and they didn't pay attention to it. They didn't take their drugs, and now they end up with the kidneys failing. Because the kidneys also have vessels. When the vessels are destroyed, that is it. It can't get any supply of blood. And then in that sense, your kidneys have failed. Now you have to be put on dialysis. How much can you pay every day doing dialysis? Let me say, if it's not even once a month, twice a month, you have to sell everything of yours to be doing this dialysis. How long can you do that? It's better to prevent this than to get a kidney failure and then let your whole family be in pain. It's not nice. Okay. So there's one other thing that I realized on our clinic. In recent years, we've realized an increasing number of younger adults getting hypertension around the ages of 20 and 30s. I was asking myself, is it the Indomie and the KFC and the McDonald's or what is causing the hypertension in these young people? So a study was done, and then there are some causes that they feel that is causing hypertension in the young adults. But the first thing that was identified was a renal artery disease. So when we say a renal artery disease, renal means kidney. Okay. So when there's a renal artery disease, there's actually narrowing of the blood vessels. So the blood vessels are narrowed. So the blood circulating in the blood vessels are actually impeded.
Okay.
The same way I said that the kidneys have those vessels, the blood going into the vessels into the kidneys are impeded, and in the end, the kidneys are just failing. So this tends to cause hypertension. So kidney can actually cause hypertension, and hypertension can also cause kidney failure.
Okay, so hand go, hand come.
Yeah. They work hand in hand.
Right.
Exactly. So that is the first cause. So the kidneys can be a first cause of a young person. So if anybody comes to you around the ages of 20 to 30 and they're having hypertension, it is not so normal unless they could be having a renal artery disease, just like I spoke about. Another cause is hormonal causes. There are few instances where we have people with hypertension that we identify the cause to be a hormonal cause. Such patients have to see an endocrinologist, a doctor who checks on hormones and distortion of the hormones and all that. So we have a condition called pheochromocytoma. This is actually a big
Such a big name.
It's not big for me and Mildred. So pheochromocytoma simply means it's a tumor that occurs over the adrenal gland. Okay. So the adrenal gland is it's a triangular organ that is lying on the kidneys, and it helps to control BP in every person. So once that gland has a tumor on it, it means its function is not going to be proper.
Right.
So the control of the BP is not fine, and then it causes hypertension to occur in a younger person. You get me,
Okay.
please? And also we have another condition called hyperaldosteronism. Hyperaldosteronism, or increased production of aldosterone hormone. So the aldosterone hormone also controls BP. It actually works in a way where it balances salt and water in the body. But when the hormone is produced excessively, that is when we call it the hyperaldosteronism. It is produced excessively. So in that way, it can control the balance of the salt and water again. And then the salt starts increasing in your body. We already spoke about salt, cutting down salt in hypertension patients. So once the salt build up in the body, what happens then?
Then you
start to have hypertension. That usually happens in the young persons as well. Another condition that causes that is called sleep apnea. I'm sure we've all heard about, most of us have heard about sleep apnea. It's a sleep disorder where breathing stops and then it comes again. So if you've seen people who snore a lot, I think the men do it a lot when they are tired. So you sleep and then your breathing pattern changes. You breathe a little and then it stops. Then you breathe again. So at that time that your breathing is stopping, there's lack of blood supply because there's oxygen that is not going into your heart. So at that time, there's pressure buildup because you're not getting oxygen supply. So blood circulation is cutting off. And you tend to get hypertension as well. So stress is another factor. Nowadays, people are stressed over emotional things, psychological things.
Every single thing.
A whole lot of work and all that, even in the younger adults. So stress is another factor. You think too much, you're thinking about something that is weighing you down, and all these things that is going on is also causing hypertension. And then I'll bounce back to the lifestyle. Please, nowadays we don't live like how our elderly people were living. You see your grandmother going for kontomire and what's not in the farm, and just come and cook and eat. We don't eat right. We are eating a lot of junky foods, which are actually destroying our health. So we need to check on our lifestyle, the sedentary lifestyle, our diet, lack of exercise, laziness. All these things are contributing to high blood pressure. So,
but doctor, you see, talking about the diet,
yes,
talking about the diet and what our grandparents used to eat, it looks like these days all kinds of chemicals are being applied to these delicious and healthy foods, and they are
even the food.
Don't they also intend giving us these problems?
It's quite unfortunate. It's quite unfortunate that nowadays, even the foods that we think that it's healthy is also being poisoned by these chemicals and all that. But I mean, it's better for you to get your fruits and your veggies than to be eating a lot of this junky diet that will in turn, yes, exactly. It's just quite unfortunate that they are being destroyed with all these chemicals nowadays. Yeah.
Right. Hey, let's go on.
So how can hypertension be prevented? As we already spoke about, I think the first thing I will mention is education, just like we are doing on social media here. So somebody comes to the clinic and you even feel bad for the person. They know nothing about their condition. Like they've never even heard about it. I'm surprised that people actually come to the hospital and they know nothing about hypertension. So I think education has to go down well, be it a medical screening in our hospitals, on our social media. I think we should cut down on all this unhealthy habits that we are showing on the televisions and whatnot, and educate people about their health, because this is killing a lot of people, even young persons, and we need to educate people on it. Also monitoring your BPs or regular health check, because I already mentioned that hypertension is a silent killer. So you won't wait until you are diagnosed with it before you start paying attention to your health. You have to monitor yourself and also go for regular health checks to be sure that you are okay. you are in good hands, like you don't have any hypertension or diabetes or whatever health condition that it may be. Also, with our diets, we need to reduce salt intake. So trying to reduce salt intake can also help your BPs to be well controlled. So if you are taking in food and then you can reduce the salt to about 2 grams in a day, the whole day, it should help your BPs to be well controlled, even if there's a potential of you becoming hypertensive or there's a family history of hypertension, that should put you on track. Also, eating a lot of fruits and vegetables. So now there's something that the dietitians call the portion control. You know, Ghanaians, we like staple food a lot. Banku, okonte, fufu, yam, all that. Cut down on the carbohydrate. Yeah. Put in more vegetables, put in some fish there, salad there, and then get a healthy diet. After that, you get some fruit. I know it's expensive in Ghana to buy apples and whatever, but I mean, the little money that you have, try and get a healthy food, a balanced diet, okay? Right. And I think this should help us maintain a healthy lifestyle. Also, exercising. Don't be giving excuses that me, I'm a doctor, but I go for jogging. At least 30 minutes of your day. I'm always stressed. I come back from work, I have to attend to my kids and people at home. But you know, you have to also think about you. Yes. Think about you. Think about your health. So after giving your attention to your husband, your kids, going to work, helping people, the sick people, that you also want to become sick in the end? No, not at all. So you also make time for yourself, about 30 minutes of the day. Do some exercising here and there. If it's even just brisk walking. I know the elderly people can't go about jogging because some of them have arthritis and all that. Right. But you can do a brisk walk. Maybe you go with somebody who will motivate you, about 30 minutes of your day. Just go along your road, your streets, walk up and down for about 30 minutes and come back home. And also, let's try and cut down on alcohol intake. Some people will say that they are occasional alcohol intakers, so they just go for funerals, but even the amount that they are taking occasionally, if you see it, it's carry forward. Yes, exactly. So avoid smoking and then alcohol, like healthy lifestyle, and limit food that are high in saturated fats. So our KFCs and what McDonald's and whatever, please, let's cut down on that and eat a healthy food. Okay. Right. So some of the myths that I realize that a lot of people come to the hospital and complain about, especially the men. So they come and you tell them, your BP is high. I think your BP is high. You let them go home to do like a week monitoring and then they come back to you. Their BPs are high. You tell them that, I have to put you on antihypertensive. Some person will just tell you that, I'm not going to take an antihypertensive. Why? Somebody told me that I'll rather die with my thing standing on than to become my God. So they have all these things that they hear from outside, that when you take the antihypertensive, you won't become a man again, you have erectile dysfunction. And some people also think that you could have a kidney failure when you take the drug, but it's not true. Please, let me say this year once again, it's not true. So if you have hypertension and it's not being controlled, that is when you start having all the signs, the erectile dysfunction and then the stroke and whatever. It will come so early. Yeah. But what I can say is that there are adverse effects to each and every medication that you take. There's adverse effects. So this antihypertensive that we give to people, there are adverse effects. Some people come saying that I have headaches. Some people come and complain of dizziness or swelling of their feet. So once you have any of these adverse effects, just go to the hospital and report to your doctor. There are 1,001 antihypertensives. So if we see that A is not working for you, we'll give you B. If B is not working, we'll give you another thing. But don't stay home and say that I'll get kidney failure and I'll get whatever. Because it's sad nowadays. So young people around 20 years and all that, dying of stroke. Dying of stroke and all that. If they had taken their antihypertensive, if they had been compliant on their medications, all these things wouldn't have happened. So please, I beg you, don't go to the herbalist and they will extort all your money. And in the end, when you have the kidney failure and the stroke and what's not, now you come to us. Sometimes it's so annoying, but what can you do? You can't leave the person to die. So these people actually tell you that there's a cure for hypertension and diabetes. It is not true.
It is not true.
Cured. There's no cure for hypertension and diabetes. And I'm saying this again, there is no cure for hypertension and diabetes. So if you go to the herbalist and they tell you that, oh, I can cure this disease for you once and for all, so give me this amount of money, please. They are just extorting your money. In the end, you come back to the hospital and you be coming with complications. In that way, we can't really help you. It is better for you to be treated in the early stages than to have complications and then come like a vegetable when you have a stroke or you have a kidney failure, when we just refer you to a nephrologist to put you on dialysis. It's not fair, please. So let's take our medications. If you are diagnosed with hypertension, please take your medication. Don't resort to herbs or whatever. Even the herbs, sometimes they give it to you. There's no
measurement.
Yes, there's no measurements. You just take a cup full, and then in the end, you are not seeing anything. You take it, you are not seeing any effects. And in the end, you have to come back to the hospital. I bet you won't get erectile dysfunction. If you take a drug for a very long time, you are being monitored, your BP, your kidney is being monitored, your liver is being monitored. We do that annually or every 6 months. We check on it. I know somebody who has taken antihypertensive for 30 years, yet his kidneys are fine, liver is fine, everything is fine. But once you don't take it, that is when you are going to have all the complications, the stroke and everything. So please, I want to tell you all the truth that this disease is not curable, but we can manage it. So please, if you are put on medications, be compliant. Thank you. So we'll move on to diabetes, but if there are any questions, I don't know, maybe we should continue before all the questions come in so that it doesn't interrupt the presentation. Please, Lena.
All right, then let's go ahead with the diabetes, and then we'll batch the questions together and deal with them.
Okay. So with diabetes, when do we say that one is diabetic or somebody has diabetes? When someone's body is unable to metabolize or break down glucose in their blood, which is the blood sugar in their blood is not being metabolized, that is when they have diabetes. So there's glucose in everyone's blood, that is blood sugar. It has to be metabolized or broken down effectively. But in some people, it's quite unfortunate that it can't be broken down effectively. So they tend to build up a lot of this glucose in their blood, and then they become diabetics. So in diabetes, there is a hormone called insulin, which actually carries glucose or blood sugar to the body cells so that we can get energy. So the energy that you use to go around doing your activities in the day is produced by this hormone. Okay, so they actually convey energy to the body cells so that we can go about our normal activities. When the cells of this body become insulin resistant, there's a build up of the glucose. The blood sugar becomes very high in your blood. And in that case, I don't know whether we've heard of the organ pancreas. It's actually in the stomach. So the pancreas, seeing that the sugar or the blood sugar is being built up, tries to produce more insulin. It produces more insulin to curb the amount of sugar in the blood. So over the years, as the pancreas is working, producing insulin, it breaks down. Over the years, the pancreas will break down. When it breaks down, the cells that are producing the insulin also stop. When they stop, that is when we have diabetes. But this actually happens in a type of diabetes that is called diabetes type 1. So the type of diabetes we have diabetes type 1, which is also known as the juvenile diabetes or childhood diabetes. And with this condition, people are actually born with it. So the cells are already destroyed. The cells producing the insulin are destroyed. So they can't produce any insulin at all to metabolize the sugar levels in their blood. So in that sense, these people have to be on insulin all their life. They always have to inject insulin, whether it's in an infusion or it's an injection. That is what they have to take to control their sugars in their blood. So that is the diabetes type 1. So these people are born with their cells, the insulin producing cells destroyed. Okay.
Yeah.
We also have the diabetes type 2. That is more like a lifestyle thing. So people acquire diabetes type 2 from a lifestyle, like a habit. So people like this are actually getting the diabetes from genetic factors or environmental factors or lifestyle factors. Okay.
Right.
So they are not born with it, but they acquire it over the years. Whilst they are growing, they can actually get it whilst growing. We also have another type of diabetes called the gestational diabetes. So just like we heard about the pregnancy-induced hypertension, that is the same way that we have a gestational diabetes. So people with gestational diabetes are not actually diabetics, but since they took seed and then became pregnant, that is when they start manifesting high blood sugar and all that, and they are diagnosed with diabetes whilst they are pregnant. So that is the gestational diabetes. There's another type of diabetes called diabetes insipidus. Diabetes insipidus. That is a very rare form of diabetes caused by deficiency of a hormone called vasopressin. So this vasopressin is a hormone that regulates the kidney to help break down sugar and everything. So when this hormone is destroyed, that is it. Then you have the diabetes insipidus. Okay. So these are the type of diabetes that we have: the diabetes type 1, diabetes type 2, gestational diabetes, and then the diabetes insipidus. So one may ask, what are some of the signs and the symptoms that you can have when you are living with diabetes? So we have excessive hunger, excessive thirst, and then excessive urination. Excessive hunger, excessive thirst, and excessive urination. We call it polyphagia, polydipsia, and polyuria, respectively. Okay, so if you are there and you realize that you started eating a lot, you just ate and you're hungry again, you are urinating so much, or you are easily thirsty, you should go get your sugars checked. Probably you're having diabetes. That is why you're eating a lot, or you're drinking water a lot, and you're urinating a lot. Somebody will say that I'm drinking a lot of water, that is why I'm urinating. But you should find out if your sugars are okay. If your sugars are okay, then that's fine. But if you are always taking in water, a lot of water, you're thirsty, and you're urinating a lot, and you're eating a lot, you should find out if your sugars are okay. Another symptoms that manifest itself is weight loss. Weight loss. So someone is there, they don't have HIV or AIDS, they don't have any chronic disease, and they are just losing weight like that. They are just losing fat. They become very skinny. You can go get your sugars checked. It could be that you're living with diabetes. That's why you're losing excessive weight. So I'm not saying just losing weight, excessive loss of weight. Okay, excessive loss of weight. It could be that you're having diabetes. That is why you are just losing weight like that. And then extreme fatigue, just like in hypertension. You just walk a short distance and you are tired. You do a little work and you are tired. It could be that you have diabetes. That is why you are having the easy fatigability. So you also need to check on your sugars and see. Irritability. So you are just restless. You're just irritable. Small thing, you are irritable. As a like you're not okay. You should get your sugars checked out as well. It could be that you're having diabetes. Confusion. You see, the symptoms are just like hypertension.
Yeah, exactly.
So you are confused all the time. You are confused. You can't even concentrate. Your sugars could be high as well. Slow healing of wound. So someone will come to the hospital and say that, oh, I was working in the farm and then something just crushed me. Small thing, no, it's a small focus, but then it spreads and becomes a big wound. And you try treating it, it's not healing. Just because the sugars in their blood is so high that the healing is very poor. And then it becomes a major problem that the surgeons have to take care of. So all these are also symptoms that you could be having diabetes. And then people with diabetes are actually immunosuppressed. So excuse me to say, they are just like people living with HIV.
Mm.
Someone will come to the hospital, you might think that this person could be having HIV because they've lost weight. When you open their mouth, what we call oral candidiasis.
Yeah.
You see those white things on their tongue. When you scrape them off, it becomes sore. And in the women, they tend to have what the Akan people call odepoa a lot.
Yeah.
Candidiasis, spinal candidiasis, because their immunity is just down. So they have a lot of fungal infections of all the oral candidiasis and the vaginal candidiasis, and their nails. They have the fungal infections of the nails. That's because their immunity is suppressed. That is why they manifest all those infections in their body. And in the women, they have UTIs a lot, urinary tract infections. So they come to you, you know that already in diabetes, urinate a lot. So they tell you, I'm urinating a lot. And some people add that when they urinate, it's burning, it's painful, like they have lower abdominal pain, and the urine coming out cause a lot of discomfort. You go and do the urine test, and then there it is a lot of pass in there showing that they have a urinary tract infection just because they have suppressed immunity. Just like in HIV or in any other immunosuppressed person, cancer patient or whatever it is. So all these are symptoms that you can find with somebody living with diabetes. Could you have diabetes and would not know? Could you have diabetes and would not know? Yes. In very early stages of diabetes, you may not find any symptom at all. So you may not have this easy fatigability, the irritability, confusion, the oral candidiasis and UTIs or the vaginal candidiasis. But then your sugars could be high. That is why it is important for everyone. It is a must for everyone to get screened once in a while. Let me say every year, at least annually. Just get yourself checked, your BPs checked, and your sugars checked.
Right.
So that you are not living with this and you do not know. That is very dangerous because you might come to the hospital only when you are having complications. That is why you rush to the hospital. Okay. So if a doctor realizes that somebody could be having diabetes, there are a lot of checks that is done on this client. So we go ahead to do a fasting sugar. We do a fasting sugar. With the fasting sugar, we are expecting that you don't get something around 7 millimole per liter and above. You shouldn't record 7. So when you use the glucometer to check your sugar, we actually prick you on the thumb and then check your blood sugar. We shouldn't get more than 7 and above. So that will if you have 7 and above, that shows that you have hypertension. I'm talking about the fasting blood sugar. That is early morning when you haven't eaten. And then we also have a test called the HbA1c or the glycated hemoglobin. HbA1c or the glycated hemoglobin. So that test, as I'm mentioning, it's so big, actually shows your sugar control in 3 months. So 3 months ago, how your sugars have been. This HbA1c or the glycated hemoglobin shows your sugar control over this 3 months, how your sugars have been like. So we shouldn't get more than 6.5%. So if your results come and you are recording more than 6.5, it means there's something going on. It has to be taken care of. Also, we have another test called the oral glucose tolerance test, OGTT, oral glucose tolerance test. So this test is also performed on individuals. So they make you come when you are fasting in the morning. So we check the fasting sugar, and then we let you take something containing a little bit of sugar, or you make you and then we check your sugars after 2 hours. Okay. So when you check your sugars after 2 hours, you are not supposed to record a sugar of 11.1 and above. So when you get more than 11.1 and above, that is also questionable. So that is called the OGTT, or the oral glucose tolerance test. Let me come to why people with diabetes can also have hypertension. Why is it that people who are living with diabetes tend to get hypertension in the long run? So when the blood sugars are elevated in the body, when we have very high sugars in the body, it stresses the blood vessels. So when it stresses the blood vessels, they become narrower. So any stress that is produced in the body causes some hormones to release that actually narrows the blood vessels. When the blood vessels become narrower, then there's actually accumulation of a plaque. It's just like fat that has become so hard. It's called a plaque that actually comes into the inner lining of the blood vessels. So when they come into the blood vessels like that, the blood flow into the blood vessels has to be with
some kind of force.
A lot of force than the usual. So it actually pumps blood like forcibly. In that way, it destroys the blood vessels. When the blood vessels are destroyed, BP will just occur because there's actually some force with which the blood is actually passing through the vessel. A lot of force like that. So it tends to cause hypertension. So if people are actually disturbed about why is it that I was having high sugars and now I'm getting hypertension, a lot of them end up getting hypertension. It's just because of this factor. So the vessels are being destroyed, and then blood circulation is becoming poorer and poorer. And then they end up getting hypertension because all the vessels are becoming narrower, and then the pressure with which the blood is circulating in these vessels come with a lot of force, causing hypertension. So in the end, all these diabetes end up getting hypertension in the end. So they could also develop atherosclerosis, which is actually meaning that there's actually a plaque that is built up in the vessels of the wall, and it increases the risk of getting a stroke or a heart attack or peripheral artery disease. I don't know whether you've seen the elderly people saying that, I say, like it hurts, like when they put their legs down, it hurts, and then that kind of thing. So it's because of all this thing going on. The vessels become weaker and weaker, and circulation is becoming very poor. So when there's lack of proper circulation in the blood vessels because of this atherosclerosis and the diabetes and whatnot, then the circulation becomes very poor, and then the vessels will start causing all this neurological problems that we tend to get, the anansi and the burning sensation in the feet and the pain in the feet. So if you have any elderly person or a diabetic or hypertensive complaining of this, that is the reason why they are exhibiting these symptoms. So it's called the peripheral artery disease because the vessels are being destroyed and then circulation is becoming very poor. That is why they are manifesting those symptoms. What are some of the, let me move to the complications. What are some of the complications that somebody living with diabetes could get? So some of the main thing that we'll talk about is the kidney disease. And this kidney disease is not an acute or an early kidney disease. They tend to come with chronic kidney disease, which nothing can be done about. So if you have an acute kidney disease, we can actually reverse it. But when it's a chronic kidney disease, we can't do a lot. All that we can help you with is the dialysis. And I've already spoken about that. So it's not a pleasant thing. And actually, people get into that state, we refer them to the nephrologist, and that is where they continue with. And then the next complication that they could have is a stroke. They are at risk of cardiovascular disease, the chest pain, heart attack, the stroke, they get all those complications. And also the peripheral artery disease that I spoke about, they have it a lot. People with the diabetes and hypertension tend to have circulatory problems because of the narrowed vessels, and then they have the pain and the anansi, numbness and all that. Yes. How can diabetes be prevented? I would also say that education here, how can it be prevented? Let's educate the populace about diabetes and the complications that they can get if it is not well controlled. Okay, so on our social media and in our hospitals, in our church places, wherever you go, marketplaces, we can educate people about diabetes and its complications so that they can be well aware of what it can do. Also, our diet. So more of fruits and then vegetables. So if you have hypertension or diabetes, you know you are eating in your condition. You don't eat like a normal child that is staying with you, that is it's margarine and bread or whatever. You have to cut down on all those things and then try and eat healthy, more fruits and more vegetables. And also alcohol and smoking cessation. You don't say that I'm an occasional alcohol person. So when I go to funerals or on occasions,
you drink your head off.
Just cut it. Try and cut. Once you are diagnosed with hypertension or diabetes, just cut all those things. No smoking, no alcohol. And then I think you live a longer life if you are also taking your medications and you are compliant with it. And then weight management. Some people are just obese. Like I know some of them are genetics, like a genetic factor, like there's nothing they can do about it. At least there's something that you can also do. You can exercise, you can check on your diet and then cut down on your weight, because once your weight is increasing, you stand the risk of getting all these diseases, hypertension and diabetes, and having all these complications. So you can do something to cut down on your weight. See a dietitian, let somebody help you, let somebody motivate you to exercise, and then this will help you. If you are put on medications, please and please again, be compliant. There is no cure for diabetes, but it can actually be managed on these medications. If you are having any adverse effects, just report it to your healthcare provider, and they will make some amendments with your medication. Don't stop taking the drug. And I repeat again, don't stop taking the drug. If you're having any adverse effects, just report it to the hospital. We will deal with it for you. Okay.
Okay.
And the other things that you can do is also, I think I've spoken about the losing of the weight and all that, and then exercise a lot. Yes. So these are some of the preventive measures that we can incorporate to help with our condition, the hypertension and the diabetes. Thank you.
Thank you so much, Dr. Yeboah. So wonderful audience. Dr. Yeboah is a senior medical officer at the Pentecost Hospital located in Medina Estate, Accra, Ghana. She discussed the topic hypertension and diabetes with us today, and lots of information, shared today. So if you have any questions, if you have any concerns whatsoever, now is the time. We have about some 10 minutes. We do that quickly, and then we see what we can do. So I have something here. Somebody says, can you elaborate on the quality of medications prescribed? In Ghana, we have different types of the same medications. Which one is of good quality to purchase?
Okay, so I wouldn't say that one medication can be preferred over the other. As I said, we have different groups of the medications. We have a whole lot. It starts from A, B, C, and in that order. Okay. So if A is not working for you, we move on to B. If B is not working for you, we move on to C. So I can't say that this medication is better for someone until you are diagnosed. I think there's somebody. Okay. So if you are diagnosed with hypertension and you go to the hospital, maybe the doctor can choose to put you on, let me say, a calcium channel blocker. That is where they are starting with. So once they give you that medication and you come back complaining, the adverse effect of that drug is sodium retention or salt retention. So you can actually get a lot of this swelling of the feet. You could have headaches. If you are reporting all these adverse effects, we change it to another drug. It could be a beta blocker or any other medication, an ACE inhibitor. So I won't say that this one will work for you until you are put on it and we see what is going on. So if we move you to the other medication and that one is working for you, we let you stay on that. Please,
Right.
have I answered your question well?
I won't believe that the person is satisfied. There is already a clapping hand. So probably, yes, the person is satisfied. So, Doc, you made mention of, regards to diet, taking in of saturated fat. Yes. So I remember way back in Ghana, they will say, oh, angwani di emendi, but engo, the palm oil is okay. That is healthy. Is that not a saturated fat?
So once they tell you that saturated fats, we know that there are plant fats and then there are animal fats. So the animal fats tend to have a lot of the bad cholesterol. Let me say that. So we call it the low density lipoprotein. That is a saturated fat. So if you do even a lipid profile or a cholesterol test, we are looking out for that bad fat, which is called the low density lipoproteins. So this trophy that you eat and the chicken and the beef and all that, they contain a lot of this saturated fat, which is the bad fats. If you eat fish, even if you eat salmon, it has a little fat in it, but that fat can't cause bad fat in your body. So you see weighing those two, you see how bad the animal fat is. So we should try and not be taking a lot of this saturated fat from the margarine, from the goat meat and the chicken and all that, and try and take in a lot of fish, a lot of these vegetables that will actually help us to keep our good fats. Okay.
Okay. So there is a question here. I think when you made mention of, some persons coming in and especially with the men, and they're like, oh, you want to give them the medication. No, I don't want to take it because probably
I'll have
my libido, whatever, will go down. A question to that effect came that at what point and at what age would you recommend that a man uses Viagra? Is it? Yeah, Viagra.
That is for us. That is for us, the healthcare workers. So once I put you on the medication, I get a lot of that. I think we are having it.
We are getting a feedback.
Yeah, good evening.
So if somebody comes to me and then I put on an antihypertensive, I get a lot of the men coming back to say that, oh, I've been on a drug for a long time and I think now I'm beginning to be weak in bed. That's how they actually say it. So there are a lot of these drugs. It's not only the Viagra. We have even types that are made from a little herb, but it's made in actual, like in tablets and all that have doses on it. When you give it to them, it actually counteracts that effects that they are having from the antihypertensive, and they come back to actually thank you. I never knew that, and it's so important to them. They'll come back to, oh, Dr. Medasepa, the drug you gave me is actually helping me now. I'm not having the symptom again. So you see, it's better for you not to die with a stroke or a renal disease or whatever it is. It's better for you to be compliant and then report your symptoms so that we can help you with the drug. I don't want anyone to be on antihypertensive and go to the pharmacy and just get a drug when you're having adverse effects. Go back to the same doctor that gave you the medication and they'll be able to help you with something to counteract whatever adverse effects you are having. If you need to change the drug to another one, that will be better for you. We'll do that for you. Okay.
Right. Okay, so I see a hand up here. Mildred, please unmute yourself and put your submission across.
Hi everybody. Dr. Yeboah, I would love for us to talk about the chart. Some people will just check it anyhow. Maybe they think they are diabetic or they are not diabetic. We are talking about diabetes here. And those that have it will need to check it properly. And there should be dates and before and after food. And then it should be Monday, Tuesday, Wednesday to Sunday. People
Sometimes
think that,
1 week
okay,
or 2 weeks.
sometimes people think that they have to check it when I wake up or in the morning. I'll just check, and then in the evening I have to check. Some people also might think that, okay, I have to check it 3 times. No, that is not how it should be. I think maybe if Dr. Yeboah finished with everything, I can just come in, and then
Yes,
everybody will take
that
a
is your
note
work,
of
Mildred.
how supposed to really, everybody will take a note or maybe a paper, and then we write a day, the date, and then when before breakfast, 2 hours after breakfast, if it is Monday, what time you are supposed to check, because you can't check it consistently every day. So when Dr. Yeboah is done, I think Paulina will come in, and Paulina will let me know so that I can come in, and then we'll do that for the last, and then I think we can close for the day.
Exactly. Thank you, Mildred.
Please, is that okay?
Yes,
Yeah.
that's fine. So we'll do that. So
Okay.
please, is there anybody with any questions, any concerns? Doctor is here. Let's make very good use of her.
Hello.
Hello, Nana. Please go ahead.
Yeah, I wanted to ask, when doctor was saying, he said, I'm the type that I like drinking water a lot. But the last time I went and checked on mine, a status of diabetes, and I was told that I should exercise more and I shouldn't eat bread. But I'm a fan of eating bread. But today I've learned that I should reduce it, and maybe from now I'll be able to do away with it. But my problem is that the last time I went to check up, I think I've not received anything after my results. So I might think that it's okay, because sometimes when you have any complication, immediately after the test, they'll call you to rectify and tell you this and that. But about 2-3 months ago, I've not had anything from my GP. So I think it's okay. So then today I've learned a lot. It's my first day of tuning in, and I've learned a lot, and I know how to control my diet and eat more fruit and vegetable. Thank you very much, doctor. Thank you.
Welcome. Thank you.
Welcome. Okay, so Doc, there are questions here. Let me read them out to you. So somebody says, Doc, is it advisable for clients to go to the pharmacy shop to buy their medications when they run out?
No. So with my hospital, this is what we do. When you come as a hypertensive or diabetic, you are put on the medications, and then they give them a card. You are given a date, and you are supposed to come back, and then we review you. So for then, we make sure that your drugs, your tablets, so if there are 30 tablets, we make sure that when it's left with 5 tablets, that is the date that you are given to come back. So once you're coming back to the hospital, you have about 4 tablets left with you. We don't wait until your medications are out of stock, like they've run out, before you come back to the hospital. Because what we realize is most of them come back after 30 days, which is the 1 month that we gave them.
Right.
Their BPs are already shooting up. Why? Because the drug is maybe finished 2 days ago or a day ago, and now this morning they didn't take any antihypertensive, and they come with even hypertensive agencies, BPs of 180 and above and all that. So it is ideal for you to go back to your healthcare provider. They recheck your BPs, they do any test that they have to perform, and then put you back on the medications that you were on. Don't go to the pharmacy. What if you need to add up to your antihypertensive and you go to the pharmacy, take the same dose, which is not actually controlling your BP? So you tend to still have this high BPs going on and on and on, because you're not going back for reviews with your doctor. So please go back to the hospital. Your BPs are rechecked. If there are any tests to be performed, they are done, and then you are put back on the medication. If they need to add up, they add up for you. If they need to cut down on the dosage, they do that for you.
Okay, so there are a few questions here as well. So somebody says, I love tea bread. This person cannot do without the tea bread, and the KFC too. You know, you were talking about the KFC and the person almost cried. He loves it so much.
So I beg you, we all like eating very sweet food.
Exactly.
It's nice to eat sweet food, but sometimes it's your own health. So I mean, you can't say that all your life you won't take it at all. Once in a while, Once in a while, you can take it, but don't let it be a habit whereby every morning you are waking up and you have to eat your tea bread and your margarine, the hot one, you know, you put the margarine in there and then you are just munching on it with some fried egg, be like that, you know, and the KFCs and whatnot. If you like a lot of bread, I think you should go in for the wheat bread or what you call the brown bread. So that one is more of fibrous content than what and it breaks down easily. So you don't tend to get a lot of these complications with your health conditions. Okay, so it's better for you to take in some brown bread or wheat bread, or if you like, just don't go in for that. Once in a while you can just take it for appetite's sake. Okay, but it shouldn't be a habit. Okay.
Okay, so I see Esther's hand up. I think Esther has a question.
Yeah, thank you so much. I think in Ghana, most of us depend on the NHIS, which isn't enough, and it doesn't cover any most of the preventive measures. So in my facility, on your birthday, you are reminded to have an annual checkup, especially for your organs.
Right.
So I'm also advising that as we are saving towards our lives, our insurance, our health, at least once in a year, go and do all the necessary labs.
Exactly.
And something will be picked up. Then you follow up from there. Thank you.
You're welcome.
Thank you so much. Thank you so much. Doc, your final words to us before we close.
Okay. So if there are no further comments or contributions or questions, what I will say is that let's all be cautious of our health. Our health is very important. Let us have a me time. We always think about our family members, other people, attending to our relatives. What about us? Let's make time for ourselves. Some people go through a whole lot of stress. Maybe you have to pay your siblings' school fees. You're thinking about that. You have to take care of your dad, your mom. Maybe you are the first child, or maybe you are the only doctor in your family. But think about yourself at some point in time. What are you also investing in your health? What are you investing in? Try and get time for yourself. You can even go to the spa one day and get a massage. Just get some
pamper yourself.
Pamper yourself. Okay, get a regular checkup. Check your BPs and all that before stress becomes a problem to you, becomes hypertension or diabetes to you. You know what I mean? So yes. let's all try and get a me time, make time for yourself, get a regular health check, or go and pamper yourself in a spa, eat good food, please. The bank, the fufu and whatever, let's try and cut down on it, our carbohydrate diet, and eat a lot of these vegetables and fruits. Let's educate other people. Even today, you are privileged to be here. What about those at home who couldn't be on the show or the program? You can also educate those people. Let's use our social media, our statuses where we put all the funny stuff and everything, and try and educate other people on it. In our churches, we can also educate people, okay? So that in the end, we all benefit from having a healthy life where we don't get all these complications coming up. Thank you so much.
Okay, thank you so much, Doc. Mildred, your nurse has something for us. So Mildred, if you're ready, you can do us.
Mildred is going to teach us about how we monitor our BP. So when you come to the hospital and you are told you are hypertensive or you are diabetic, and you need to do a BP monitoring or a blood sugar monitoring, how you are supposed to go about it. So Mildred, hello.
Hello, hi everyone. Okay, so I'm ready. So I hope your papers or your notes are ready because we have a long chat here.
Right away, we can roll.
Okay, so on your paper or on your notes, you write a day.
Okay.
A day. And then we have Monday, Tuesday, Wednesday, up to Sunday.
Okay.
Okay, so if you've done that, then we have before breakfast. Okay. Should I go ahead?
Yes, please. You can go ahead.
Okay, before breakfast, then 2 hours after breakfast. That is the checking of your glucose.
Okay.
And then we have before lunch.
Mhm.
Then we have after lunch.
Okay.
Can I go ahead?
Yes, please, you can.
And then we have please, did you get the before lunch and after lunch?
Yes, we've written that. We have before lunch and after lunch. Right.
Okay, then before supper.
Okay.
Then after supper. Then we have 4 a.m. 4 a.m. Okay, so on Monday, are you done? Are you done with the?
Yes, we are done with the
Okay.
timings.
So on Monday, this is how you check it. You check it twice. That is before breakfast and 2 hours after breakfast. That is Monday.
Mm-hmm.
Then Tuesday, you check it before lunch and after lunch.
Before lunch and after lunch. Okay.
Then on Wednesday,
Uh-huh.
before supper and after supper.
Before and after. Okay.
Please, where am I? Is it Wednesday?
Wednesday, before and after supper.
Yes. Okay, so then on Thursday,
Right.
before breakfast and then 4 a.m.
Okay.
Then on Friday, before lunch and after lunch. On Saturday, before breakfast, after breakfast, before supper, after supper. Then on Sunday, before lunch and after lunch. Please, if anybody couldn't get any of the days, you can alert me so that I repeat myself. Thank you.
Thank you so much, Mildred. Thank you so much.
So Mildred is my nurse. I'm working with Mildred, she's my nurse. So that's why she's educating you how to chart your BPs and your sugars. Okay.
Take a seat.
Thank you very much, Mildred.
Thank you so much, wonderful team. Thank you. So somebody says, please, I am scared to go to hospital for tests because of is it negative result. I really love bread, and when I exercise, it does not work for me. Not too clear. I think that this person would like to know her status as to whether she's either diabetic or hypertensive, but she's scared to do that because she doesn't know what the outcome is going to be. You know, just like Doc said, come what may, your life is so much important and you would want to know what is happening in your system. So would rather want to encourage you to go to the hospital and find out if you are okay. Yes. So that said, all too soon, we have come to the end of today's episode of the SEER Show. It was wonderful having you, Doctor. Your presentation was amazing. We are definitely bringing you back on the SEER Show. The comments are running there. Wonderful presentation, good information. I mean, our health is very, very important. And so, wonderful people, it has always been good having my audience. Keep inviting people to benefit from what we are benefiting from. Just like Doctor said, we need to educate the people out there. And this is how we can do it. Okay, let's bring people on board to enjoy what we are enjoying. This program is a proud initiative by Prophetess Rhoda Anna of Manifestation of Holiness. We meet here Mondays to Fridays to pray in the morning, 12 a.m. US time, 4 a.m. Ghana time, 5 a.m. UK time, 6 a.m. Europe time, 7 a.m. Lebanon time, and 1 p.m. Japan time. We also meet on Mondays, Thursdays, and Fridays for our Zion hour and time with the Word of God, respectively. And the times are 12 p.m. US time, 4 p.m. Ghana time, 5 p.m. UK time, 6 p.m. Europe time, 7 p.m. Lebanon time, and 1 a.m. Japan time. My name is Lina. You can call me Paulina or Ajua Kasabo. I am the host for this program. I also have a co-host in the person of Elizabeth Sena. So from time to time, when I am not around, she does that. Sometimes we do it together. I want all of us to take very good care of ourselves till we meet again on the CS show. It's bye-bye, and we love you so much.
Bye.
Bye, everyone.
Nana.
I think I'm to show. I'm also being I'm telling on the
Hey, Grandma Petit Tomatoes.